of the president's own party, mainly this group of Democrats called the Blue Dogs, a group of more conservative Democrats from centrist districts. They have serious concerns. How much will it cost? They have concerns about a big proposed tax to pay for it. Can the president's deadline be met? Let's get the answer from House Majority Leader Steny who joins us from the large House gallery. Leader Hoyer, thanks for being here. Will you recess with the health care bill or without one?
Jane, we're very hopeful, and we believe we'll be able to pass a health care bill next week. Now, the committee is still meeting. It hasn't passed out its bill. It's still having discussions with its members, the chairman, Chairman Waxman. Obviously, as you indicate, there are a number of members very interested in costs. We've said that we're going to bring costs down. We're going to bend the cost curve, so over time the percentage of dollars that we spend on health care will come down in this country. We've indicated that we want to make sure that all Americans have access to affordable quality health care. And very frankly, every member of the caucus, every member, from Blue Dog, Progressive, and everybody in between, says they want to vote for a health care reform bill, and the American public wants to see one. So we believe we're on target. We're working very hard to get there, and we're going to get there. We're either going to get there through committee by the end of this week, and through the House by the end of next week, and into negotiations with the Senate over a conference report. But we're working very hard towards those ends.
Congressman Hoyer, if you don't get them before you recess, would you ask members to stay through their vacations and get this thing done?
Well, I don't think it's so much a question of staying, because what we need to do and what people will continue to do is to continue to work on this, because failure for the American people is not an option. We know that we need health care reform. As a matter of fact, as you know, the issues during the last presidential campaign very much centered on health care reform. Senator McCain was for health care reform, Senator Obama, Senator Clinton, other presidential candidates. So there's no doubt that this was a huge issue for the American people. They believe we need to accomplish the objective of bringing their costs down for their families, for their businesses, for individuals. They know we need to cover all Americans, so many of which are getting health care but not paying, and the rest of us are having to pay that bill. They know we need to get all the waste, fraud, and abuse out of the system, so that failure is not an option here. We're going to continue to work, and we believe that we're going to be on target.
And we all know that, and everybody, as you say, may want to fix it because the costs are not sustainable over time. But the question I think a lot of people have is, what's the rush? Why the artificial deadline? Why not do it and do it right, as opposed to doing it quick?
Well, we want to do it, and we want to do it right, and we're going to do it right. And, you know, this business, Jane, of the rush, we've had over 80 hearings on health care reform over the last 2 years. This was debated very extensively, as I just pointed out to you, over the last 18 months, 12 of which were in the presidential campaign of 2008. Each candidate had a very specific plan. Very frankly, the bill that now is pending in the Energy and Commerce Committee has many of the components that were included in all of those plans. So the thought that this has been rushed is simply not the case.
And the thought doesn't come from me, Congressman, just with all due respect. You know, the thought has been coming from people in your own house and your own party.
No, I understand that, but I don't agree with them. When you consider something from 1993 to today, in terms of health care reform and including all Americans in the security of having access to affordable quality health care, that's 16 years ago at least. We've been really working on this for 6 decades. It's not rushed. When you had 80 hearings over the last 2 years, it's not rushed. When the presidential campaigns dealt with this extensively for 12 months last year, it's not rushed. So I simply, whether it's, and I don't allege it's you, but those that say we have rushed this, I think are not accurate. It is tough to do. People want it done, but it's tough to do. There are a lot of interest involved here, so that it is taking time. And we're going to give it the time that it takes, as you point out, to get it right. We want to get it right. But we don't think that simply considering it for another 16 years will necessarily be solution to getting it right. We need to get it done.
Some have suggested, Congressman Boehner said there are no more arms to be broken, because a lot of Democrats had twisted arms over the energy bill. They didn't really want to vote for that bill called cap and trade, but they did, and they don't want to be pushed into something this time around that, as one Blue Dog Democrat said, people went home and they didn't get a hero's welcome for that energy vote. They don't want to have to go back and at that same scenario when they go home and people are not happy.
Jane, I think personally the energy bill was a very good bill, and it dealt with 3 specific things the American people wanted done. First of all, it's a job creation bill. Energy efficient technologies and innovation are going to create somewhere in the neighborhood of 2 million jobs over the coming years. Secondly, it was a national security bill, bringing us energy independence over the next few years.
But
and thirdly, it was a save our globe bill. So what I'm saying to you is, I think the public, the more they learn about that bill, and the more they are that the information given to them by too many people, particularly on talk radio, which is incorrect. There are no taxes in that bill, contrary to what the Republicans say. On health care, I think we are also doing something the American people want done. And it is for that reason that I think our members will be in good shape.
We're about to be cut off, unfortunately, by one of those computerized breaks, so I don't have a choice, but we appreciate your time. House Majority Leader Steny Hoyer. And just quickly, before we go to break, we'll have more on the Michael Jackson story that's breaking as well. We'll be right back.
There is a raid underway. The Drug Enforcement Administration raiding